I'm here today with Dr. Patrick Glading. Hi, Patrick.
Hi everyone, hi Patricia.
Right. Okay, right. So can you tell us about the topic today?
So I'm interested to talk to you about triglycerides. It's an area that's often been ignored, and I think the main reason is until now we didn't realise that triglycerides were important. We often see them as elevated in people with diabetes, obesity, metabolic syndrome, but we don't really know how important they are and what we should do about them.
Yeah.
So it wasn't until the genomic studies came along that we realised that things like HDL, which we call normally good cholesterol, are actually non-causal. So they don't have a strong relationship with cardiovascular disease in themselves. It's the relationship with triglycerides that's important.
Yeah, and most of the time over the last, 20 decades, we put emphasis on reducing LDL to get optimal cardiovascular outcome. But triglyceride, we will treat the number sometimes, but we're not as aggressive as treating LDL levels.
Yeah, absolutely. We've done a lot of trials in cardiology looking to raise HDL, and they've all failed, essentially because of that issue around HDL being not the most important lipid molecule. LDL still is the most important, but triglycerides are up there in terms of level of importance. There's lots of lipid particles that are also pro-atherogenic that we don't measure that have triglycerides in them. So it is important to get the triglycerides down. And the main way we do that still is with statins. Then we have fibrates. But the most exciting thing are these new EPA-only fish oils that's the main reason for talking today about.
Yeah. So tell us about EPA and what is the dosage that's used in the trial at the moment?
Yeah, so the dose is generally pretty high. I think to start off with, there has to be a distinction between what a standard fish oil is and what an EPA-only fish oil is. Over the counter, most of the fish oils you buy have both EPA, which is eicosapentaenoic acid, and docosahexaenoic acid, that's DHA. There was a study many years ago called JELIS, which was done in Japan. It's JELIS.
Yes, I saw that, yeah.
Yeah, and that showed quite good benefits to people who were taking EPA-only fish oils. So in New Zealand, we participated in a multi-centre trial called Reduce It, which was run out of Harvard, and it showed that in a large population of patients with established cardiovascular disease or diabetes, that lowering triglycerides with EPA-only fish oils had quite a significant benefit.
Right, okay. All right, so can you tell us about the REDUCE trial? What is the design of the trial and what are the endpoints?
Yeah, so it was a randomised controlled trial. It was a multi-centre study. As I mentioned, there were New Zealanders in the study too, but it was run out of the US. It enrolled around 5,000 patients, randomised to placebo. Now the placebo was a mineral oil, so there was some question about whether the mineral oil was actually a negative effect and made the EPA fish oil look good.
Right.
But in any case, that debate's ongoing.
Yeah.
The outcomes were measured over 5 years, and they're all the standard ones, so cardiovascular outcomes, cardiovascular death, all-cause death, and measured triglycerides and lipids.
And these are on, the trial was done on mostly people with confirmed diagnosis with coronary artery disease, and they're already on statin?
That's right, yeah, they're all on effective lipid-lowering therapy already, so this was, like you say, add-on to established therapies.
Right. And what was the outcome of the trial?
So the outcome was excellent across all the outcome measures. So there were significantly reduced numbers of myocardial infarction, cardiovascular death, and reduced revascularization rates as well. So actually less PCI being done in the treatment arm of the study.
Right, okay, by 25%.
Yeah, right, you're right, absolutely. Quite a considerable amount, and with a very, very big p-value.
Yeah.
Or very small p-value, depending on how you look at it.
Okay, so how do we translate that to our clinical practice in the future?
Yeah, so at the moment, the EPA fish oil used in that trial, it's called Vascepa. It's available only in the United States. It's expensive, I believe around $300 a month there,
Wow.
Which is a lot, because most fish oils really shouldn't be more than $40 to $60 a month. The fish oil they used was very specific, and it's not yet known whether you can generalise to other EPA-only fish oils, but you probably can. And there are others that are out there that are available online that only contain EPA, that also lower triglycerides and probably have the same effect. The other bit of good news is that the company, well, not good news for the company making this, but they've lost their patents, which means there'll be generics on the market very soon. So keep your eyes peeled for EPA-only fish oils to treat triglycerides.
We have to really look carefully on the bottle
On the
about
bottle.
the actual ingredients in the fish oil.
Yeah, right.
Yeah.
And we don't know yet what it is about EPA, and it's not that DHA is bad, but it's something to do with the ratios and the dominance of one over the other, I think.
Right, and hopefully we get some long-term results out that will guide us to give a target for treating the triglyceride level to improve cardiovascular outcomes.
Absolutely. We don't have, like with LDL cholesterol, it's quite clear to us, what's high, what's considered very high.
In fact, I think the LDL target nowadays is so low, 1.4, it's getting to the point of slightly being inaccurate, because the really low LDL is less accurate than sort of medium range. So the laboratory has to use the total minus the HDL.
Absolutely. The sensitivity and precision of these things becomes less.
Anyway, we need I think this is one area to look out for in the aggressive risk factor management for cardiovascular health.
Yeah, right. I mean, triglycerides being high, above 9, is also a risk for pancreatitis. And as you know, that's a medical emergency. So, lowering triglycerides above that level is obviously really important. But yeah, in the future, hopefully there'll be more information about what numbers to treat to and to benefit our patients.
All right. Okay. Thank you very much, Patrick.
Thanks, Patricia.
That's it for this one.